What is the most common STD in Singapore?
I don't know.
Any thoughts?
Herpes.
Herpes.
HIV? AIDS? I don't know.
Wrong.
It's like G.
Yeah,
Girl or something. I don't know.
I have no idea. I don't have it, so I don't know. AIDS.
Okay. Starts with a C.
I feel like I've heard this before, but I can't remember. No idea.
No.
What is the most common STD in Singapore?
Gonorrhea.
Syphilis.
Wow. It isn't, but they are in the top 3.
Is this a multiple choice?
I can give you 3 choices. You can guess.
Oh yeah, sure.
Okay. Gonorrhea, syphilis, or chlamydia?
Gonorrhea?
Nope.
Syphilis?
Nope.
Chlamydia?
So I don't know.
Chlamydia? Chlamydia is correct.
Like chlamydia or something?
You are absolutely correct. You're the first person to get it right the first time. All right, let's talk about what we just saw. It's much more comfortable. In Singapore, the Department of STI actually reported that chlamydia is the #1 most common STI, followed by gonorrhea and then syphilis. Here's a little bit more about chlamydia. It actually affects both men and women and is caused by this bacteria right here, which I cannot pronounce, hence it is on the screen. For men and women, if there's any pain when you're peeing, if there's any change in color of your urine, for women, your vaginal discharge, if there's any change there, might want to get checked. Also, if there's any pelvic pain, yeah, those could be signs that you may have chlamydia. Gonorrhea multiplies in warm and moist areas of your body, which could be, but not limited to, your urethra, your vagina, your eyes, or your throat. Okay? If left untreated, it may spread locally, causing health complications, so get checked. Syphilis is a highly contagious STI caused by the bacterium Treponema pallidum. It's there. It can be spread through unprotected sex, blood transfusions, or cuts on the skin. Syphilis occurs in 4 stages, okay? So listen up. The primary stage, where symptoms may include painless sores on the genitals and sometimes around your mouth. This is a pimple, just letting you know. The secondary stage is where you could get symptoms like rashes or sore throat, headaches, fatigue, weight loss. The latent stage is where there are no visible signs or symptoms. And the tertiary stage is where you could have permanent damage to your organs. Getting an STI is nothing to be ashamed of. It is very easily treatable. Once you kind of have a feeling you might have one, especially if you're sexually active, it is important to get tested. If anything, just remember your ABCs, okay? A, abstinence. B, be faithful. C, condom, use it. I personally do not abstain. I follow the ABCs, just not the A. Don't tell my mom. Before you start getting sexually active, I would say get educated first. This is a great first step, watching this video, well done. But of course, you gotta educate yourself on what kind of contraceptives you wanna use and all that kind of jazz. But we'll talk more about that later. So close.
Gonorrhea.
Gonorrhea? Gonorrhea is wrong. It's the wrong answer, but well done for getting there.